very simple records for an edentulous case are the denture that fits, right? With reline, hard reline if needed, it fits and it has markers on it. You can purchase these markers from us. You can purchase them from Suremark, SUREMARK.com. Buy a bunch, buy them from us, put 6 of them on your denture, randomly placed. This has all 6 in the palate, perfectly fine. That's 5. Should be 1 on the buccal as well. You can place them on the buccal, facial, don't put them on the teeth, patient has to bite, and don't put them on the intaglio, patient has to bite, not comfortable, because these little nubs here are about 1.5 to 2 millimeters thick. All right, so literally random. Literally random. We have a video on our website that shows start to finish about taking a dual scan with a live patient in a cone beam. It's on the records page. Watch it. There's a whole bunch of videos on that page. Or if for some reason you scanned your denture, you duplicated it something, we can make a clear dupe and put some gutta percha markers. We can use, you can use gutta percha markers, or you can use stickers, or we can even put little beads in them if you'd like. You can do that, 2 different options. Easiest way, stickers. So denture, I'll just repeat real quick. Dentures must fit well, no movement. If a reline is needed, make sure it's hard, not soft, because it'll be a gap. There'll be a gap between the denture and the tissue if it's soft. Tooth position should be ideal, right? We want the teeth to be ideal. They don't have to be perfect. We create marvelous setups based on existing dentures, so we can move teeth, midlines, open, close. We can do all kinds of things, but we want a good centric occlusion, good occlusion. And then you can use this green or blue mousse. And then always, 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 when you're taking your cone beam, when the patient's wearing the appliance, in occlusion with the chin on the chin rest, always, never open. And then it's a dual scan, right? So the denture is scanned to the mouth, and then the denture is scanned by itself on a scan table, sitting on a piece of foam or sitting on a couple of cotton rolls, always above the plastic if your scan table is plastic. Very, very important. Green mousse or blue mousse both work as reline materials. Just load it, seat the denture, and then do your dual scan. Works brilliantly. When you take your CT scan, what you'll see is 3 different scans, okay? This is, 3 different visualizations here, okay? There's gonna be 2 scans on a single arch. Patient wearing the scan appliance. You can't see it because it's a different density than the bone, but the markers are all there. So you know the patient's wearing the appliance. And then the appliance alone. Those are the 2 scans, all right? Put it on foam, don't put it on plastic. It becomes the plastic, they meld together. Then on our end, you will see the patient with the appliance. We take the 6 points on the appliance, we register them with the 6 points in the mouth, and then we can turn the denture on and off, right? While we're planning. We can see the teeth, we can turn them on and off. And then on our end, the physical records on our end, you send in an opposing model, right? Or taking a digital impression. We prefer analog records for dentures because we want an analog bite, not a digital bite. We want an analog bite. So that you might as well just take an analog model and ship it in. Either way, it works fine. So these are the records. We printed this from the CBCT of your denture. We just printed it. We put it together with your bite and we articulated. Those are the edentulous records, very straightforward. The images down below are about the same thing. They're just of a scan appliance instead of a denture with markers, right? And use our checklist. Always use a checklist. We've made sure that it's perfect to help you. And then real quick, this is doubly dentulous. It's just single, a little bit modified. We don't need any physical records. And as long as the patient has good solid occlusion, we don't really need a bite sent to us either. We can hand articulate. If it's a problem with the bite, if the patient is able to slide around in the denture, send us a physical bite in the mail. Otherwise, it's dual scan. So this is upper with the denture, lower with the denture. All right, this is taken at the same time. Put both dentures in the mouth and scan the full field of view. Now, if your CVCT is not a large FOV, then you'll need to capture 2 scans with the dentures in the mouth, one of the lower, one of the upper. The appliances come out, scan them individually on the scanner. Scan the lower, scan the upper on a piece of foam, and then in our end, this is what we see. Those are the records for doubly dentulous. We do not need study models, impressions of teeth, impressions of tissue. We don't need any of it. We just can't do anything with it. We can't mount stone to dentures. So that's we only need upper lower dual scan. So let's go through one last part of the program, and that is uploading cases. So on our website, we have this little icon here all over the Chrome page. So if you let's just go to our home page of our website. Okay, and we have an area here that's dedicated just to Chrome GuidedSMILE, Chrome GS, and anywhere on any of these links is a link to submit a case. Okay, and I'll just to share with you, this is an intro to Chrome. This is where our FAQ is. These are articles. These are ask questions to us. Fundamentals of Chrome ebook. We have just thousands of hours dedicated to this, just this one area of our website. Schedule a Chrome records meeting like we talked about, and then you can attend it by clicking here. How to export CVCT files, how to export iOS files. It just goes on, and you can search for most things here in our search bar. Otherwise, just follow the tree. And this all goes through the process, right? Intro to Chrome, patient records, pre-surgical decisions. What are you going to do? No hole, small hole, etc. Day of surgery, everything to help you with the day of surgery. And then restorative phase, and then just a whole series on educational videos. Okay, so back to the point of coming in here, which is submit a Chrome case. We have a lot of work in this to make it friendly for the team, very friendly, which is it's basically everything you ever wanted from an RX, but it's a little more interactive. All right, so you'll fill out all the information about your office. If there's another doctor working with you, there's an option in here to to give us information on that, on where to ship to the case, that kind of thing. Information about the patient, and then treatment options. So you'll go through and pick single arch, double arch. You'll let us know if it's upper single, lower single. I'm not going to go through all these because a lot of these are going to be very simple, straightforward questions. But tell us about the opposing arch, right? Tell us about the design, whether it's going to be standard, small hole, no hole, that kind of thing. Tell us what teeth are mobile. Tell us about the patient's teeth that are the arch of interest. Give us the shade of the tissue, shade of the teeth, etc. Those types of things. And photographs and what to do with them. And then impressions. Which iOS scanner are you using? Or are you just simply sending us in the mail with this RX? Special design for the smile. How are we going to design the teeth? What are we going to do? Here's a section on VDO. Is it okay to open the bite 4 millimeters without calling? I love this question because most cases need to be opened, and we are very good at it. Very good at taking centric bites and opening and going to surgery and having a very successful surgery. But there's other options here. And then how much to open. Let's keep going through this. So then there's surgery information, which is tell us about your implant, your guided kit. Tell us if you want chairside support. Tell us if you need pins and drills. A lot of these things we'll cover again during the online meeting, but we want to know where you are with this patient and with your instrumentarium, your armamentarium, your instrumentation. Tell us about working denture, working side denture, opposing denture, that kind of thing, etc. All right, and then we just kind of give you a little hint of how long things are going to take, general notes, and then the price will be here. It's an estimate, but it's very close. You'll know exactly what the case is going to cost. Then you click submit your case and upload. Now, I didn't fill out anything, so it's gonna hold me up. But then you click submit. This will email you the RX that you can send with your physical records. Okay, so let's go back to this. So that's submitting. I think you'll find that RX is very helpful, very friendly to use. And then once you click submit in that RX, then it will take you to this second page. And I believe this is auto-filling now from the previous stage information, which is nice. You'll get here and it'll say Mrs. Jones. And you might need to add your email address, but I think it all comes over. And then you can either drag or drop your files here, or you can browse, one or the other. So this means you'll take your zipped folders of DICOM, your separate STL files from your digital impression scans, then individual photographs, drag and drop them in here, follow our checklist. We only need 6 or 7 photos, not too many more than that. If you'd like to send us other photos, it's fine, but we really only need those that we have. So drag them all in here, click submit. These two join on our end, and we get a very efficient way, one area to download your files, get started on the case very easily based on just these 2 pages, RX and then upload page. So if you ever have any issues with uploading, we have our team. Our team is excellent. They are very friendly people. They are very knowledgeable. They literally do this all day on the phone, through the email, through working with records and getting these cases going. And they would love to hear from you if you have an issue, and they would love to join you online on your cell phone with your camera on, verifying your models, by an appointed date. So please schedule those, and we can get your cases done very efficiently. So thank you very much. I hope there's questions. Love to take some questions and do a little Q&A at the end. I'm always available. That's my email, that's my extension. I would recommend anyone in the dental team to join our Facebook group. This is a private group just for doctors and for team members. This is where we roll out our updates. This is where we share some of our secrets, not all of them, but some of them, a lot of our tips. We post cases, talk about successes, we talk about failure, we talk about everything on there. But we do keep it private just for doctors and teams. So join and we'll let you in. And then let's see if we have any chats, which we don't. Perfect. That means I gave a perfect presentation. Email me any questions if you don't want to share them in a chat. Perfectly fine. Email me, call me, have a chat. Everyone have a wonderful Thursday and end of your week. Thank you very much.